Hi, my name is PEJE from BSN 1-2, and today I am going to demonstrate to you log rolling a client. But before we proceed to the demonstration or to the procedure, let us check the client's medical record and perform pain assessment and check the ability of the patient to assist the procedure. The equipments that we're going to be needed is pillow, the client's MOR, and the friction reducing device. Then let us determine the assistive devices that will be required, encumbrances to movement such as an IV or a urinary catheter, medications the client is receiving because certain medications may hamper movement or alertness of the client. Lastly is the assistance required from other healthcare personnel. At least 2 to 3 additional people are needed to perform this procedure. Okay, then let us proceed to procedure number 1. Introduce yourself and verify the client's identity. Explain to the client what you are going to do and how the client can participate in the procedure. Since my client is child, I'm going to ask her name and age only. Good morning, ma'am. I'm Ishi, your nurse today. Ano pong name? Age po?
7.
Okay, thank you. Okay, ma'am. Today, I'm going to perform to you a log rolling. This is to reduce any pressure in your back, especially in your spine. Is that okay po? Okay. Second is perform hand hygiene and observe other appropriate infection prevention procedures. So I've already washed my hands and now I'm going to use alcohol-based hand rub to prevent any possible microorganisms and provide for client privacy. This is for the comfort and safety of the patient. So I've already closed the windows and door. Then position yourself and client appropriately before the move. Then place the client's arm across the chest. So ma'am, I'm going to place your arms across in your chest. Is that okay po? Okay. Then the other. Since my client is child and I don't have any assistance, I will going to do it on my own. I am going to use a friction reducing device to facilitate a log rolling. First is stand with another nurse on the same side of the bed. Assume a broad stance with 1 foot forward and grasp the rolled edge of the friction reducing device on a signal. Pull the client toward both of you. Now I'm going to forward my 1 foot. And then I will grasp the roll edge of the friction reducing device, this, and then one nurse count 1, 2, 3, go. Then at the same time, all staff members pull the client to the side of the bed by shifting their weight to the back foot. So now, ma'am, I'm going to pull you to the side of the bed. At the count of 3, 1, 2, 3, go. Okay. One person moves to the other side of the bed and places supportive devices for the client when turned. Okay, then place a pillow where it will support the client's head after the turn. So now I'm going to place this pillow over here. And then place 1 or 2 pillows between the client's legs to support the upper leg and when the client is turned. Okay, ma'am, so I'm going to roll over first your blanket. Okay. And then I'm going to place 1 pillow between your legs. Okay. I will move to the other side of the bed. So let us assume that we are in the hospital and I'm using a hospital bed. Okay, go to the other side of the bed farthest from the client and assume a stable stance. Then reaching over the client and grasp the friction reducing device and roll over the client toward you. One nurse count 1, 2, 3, go. Then at the same time, all nurses roll the client to a lateral position. Okay, ma'am, at the count of 3, I will roll you to a lateral position. Okay po ba yun? Okay. 1, 2, 3. Okay. Then I will change my position again to this side. Then the second nurse behind the client helps turn the client and provide pillow supports to ensure good alignment in the lateral position. Support the client's head, back, upper and lower extremities with pillows. Okay. Then I will roll over your blanket again, ma'am. Then raise the side of the rails and place the call bell within the client's reach. So I've already raised the rail, and okay, I will move to the other side of the bed, in the side of the bed, and I will place a call bell. Okay, ma'am, and here's your call bell po. Okay. After the procedure, apply a alcohol-based hand rub to prevent the spread of possible microorganisms. Then document all the relevant information to the client's record. Document the time and change of position moved from and moved to. Then document any signs of pressure areas, use of support devices, ability to the client to assist in moving and turning. Then lastly is the response of the client to moving and turning, such as anxiety, discomfort, and dizziness.